Module 1. Why should I be concerned about lead-based paint? Upon completion of this module, you will be able to explain what lead-based paint is and why it is a problem for renovators, the health risks of lead to children and adults, why we're concerned with lead-contaminated dust. What is lead-based paint? Lead-based paint is any paint or surface coating that contains lead equal to or in excess of 1.0 milligram per square centimeter or more than 0.5% by weight. Paint with concentrations of lead lower than this definition can still cause health problems. Information on how to determine if a property contains lead-based paint is provided in Module 3. Some states and localities can still have a lower level of lead. Make sure to check with the local towns, counties, and state in which you work. Lead-based paint was banned in 1978 by the Consumer Product Safety Commission. In practice, this means that homes built in 1978 can still use lead-based paint because existing supplies of paint still existed after 1978. Health risk of lead. Children are at a greater risk than adults because their bodies are developing. During normal and frequent playing or hand-to-mouth activity, children may swallow or inhale dust from their hands, toys, food, or other objects. In children, lead can cause nervous system and kidney damage, decreased intelligence, attention deficit disorder and learning disabilities, speech, language, and behavior problems. Among adults, pregnant women are especially at risk from exposure to lead. Lead is passed from the mother to the fetus and can cause miscarriages, premature birth, brain damage, low birth weight. Health effects of lead in adults include high blood pressure, fertility problems, digestive problems, nerve disorders, memory and concentration problems, sexual disorders, muscle or joint pain. Symptoms of lead poisoning are not always obvious. The symptoms of lead poisoning are often nonspecific and are frequently attributed to other causes. Specific symptoms that people with lead exposure sometimes complain include headache, stomachache, irritability, fatigue, loss of appetite, joint and or muscle pain. Because many symptoms are nonspecific or similar to flu symptoms, parents may not be alerted to get immediate medical attention for their children. This is critical for young children. The longer a young child stays untreated, the higher the risk of permanent brain damage. Workers with occupational exposure to lead need to inform their doctors in order to give them all of the background needed for an adequate evaluation of symptoms as possibly related to lead exposure. The best way to determine if lead is present in the body is by testing the blood. The blood is measured in micrograms per deciliter. Even a very small amount can cause a great hazard. To give you an example, a microgram is 1/1,000,000th of a gram. That is like 1 penny out of $10,000. Why are dust and debris a problem? Dust and debris from renovations, repairs, and painting jobs in pre-1978 housing in child-occupied facilities may contain lead. Renovations, repair, and painting jobs disturb the paint that may contain the lead. Any activity involving surface preparation, such as hand scraping, power sanding, the use of heat guns above 1,100 degrees Fahrenheit, and open flame burning can generate lead dust. More complicated tasks, such as removing building components and demolishing walls, also can create a lot of dust. Small amounts of lead-contaminated dust can poison children and adults. A tiny amount of lead can be extremely harmful. Leaded particles are often so small that you cannot see them, yet you can breathe or swallow them. These smaller inhaled or swallowed dust particles are more easily absorbed by the body than larger particles and can therefore be more easily hazardous. Leaded dust may be breathed in and swallowed by children, residents, and workers. Adults can swallow or breathe the dust during the work activity. As they are performing scraping, sanding by hand, or the use of power sanders or grinding tools, dust is being created. The dust goes into the air that they breathe and thus causing a lead hazard. A little dust can go a long way. You can't see it. Even a floor that looks clean can have leaded dust on it. Only a laboratory test can tell you for sure if an area is contaminated with lead. It's hard to sweep up, and it travels very easily. Later in this course, we will discuss in detail the EPA and HUD dust lead hazard and clearance standards. The limits are included here to reinforce the idea that there are very small amounts of lead and can cause health problems. These numbers represent the amount of lead measured in micrograms. EPA and HUD use these standards when clearance is performed. Floors, 10 micrograms. Interior window sills, 100 micrograms. Window throws, 400 micrograms. Again, some states and localities may enforce lower standards. 1 gram of lead paint can contaminate a large area. Now you know what lead paint is and the adverse health effects of lead. You understand that dust is the problem. Lead poisoning is hard to spot and the effects can be permanent. Kids are most at risk for lead poisoning, and ultimately, lead poisoning is preventable.